Today, we are going to walk through something that is so important, the breast self-exam. And I want you to think about this differently. This isn't about nervously searching for something wrong. It's about getting to know your body, about becoming familiar with your own normal. It's an empowering routine that really puts you in control of your health. So, let's get into it. So, why is this such a big deal? Well, let's start with a number that really puts it into perspective. 8 out of 10. That might seem like just a statistic, but what it represents is huge. Exactly. The vast majority of breast lumps aren't found by a doctor. They're found by women themselves. And it makes perfect sense, right? No one knows your body the way you do. That intimate knowledge makes you the absolute best first line of defense for noticing when something changes, which is key for early detection. And that really gets to the heart of why we do this. This isn't about trying to be a doctor. It's about becoming an expert on you. The whole point is to figure out your baseline, to learn the unique landscape of your own breasts. Once you know what's normal for you, any little change is going to stand out so much more clearly. That familiarity, that's your superpower here. Okay, so when's the best time to do it? Well, it turns out that consistency and timing are everything. They help make sure that what you're feeling is reliable and not just a normal monthly change. Making this a monthly habit is the goal. It just becomes part of your routine, like any other part of taking care of yourself. But the specific day you choose during the month actually makes a difference. And this is super helpful because it breaks it down for everyone. If you get a period, the best time to do your exam is a few days after it ends. That's because your breasts are naturally at their least swollen or tender then, which gives you the clearest picture of what's going on. If you don't menstruate for whatever reason, it's even easier. Just pick a day that you'll remember every month, like the 1st or your birthday, and just stick with it. All right, let's get into the practical how-to part of this, starting with step 1. Before you even touch anything, you're just going to look. This is the visual check. So find a mirror and a room with good lighting where you can really see everything clearly. You're going to check out your breasts in a few different poses to see them from every angle. First, just stand naturally with your arms relaxed by your sides. Then, press your hands firmly on your hips. When you do this, it flexes your chest muscles, and that can actually reveal changes you might not see otherwise. Finally, raise your arms straight up over your head. Each one of these positions gives you a slightly different view. So what are you looking for exactly? Really, it's anything that's new or different for you. Look at the overall size and shape. Check out the skin. Are you seeing any dimpling or puckering? Sometimes it looks like the skin of an orange. Any redness or sores? And pay attention to your nipples. Has one of them suddenly turned inward? Is there any kind of discharge? Okay, moving on to step 2, the manual check. This is where you'll use your hands to actually feel the breast tissue. And you've got a couple of great options here. Doing it while you're lying down is fantastic because your breast tissue spreads out evenly across your chest, which can make it easier to feel things. The shower is another really popular choice because with soap and water, your fingers can just glide super smoothly over your skin. Now, this part is so important, your hand technique. You want to use the pads of your 3 middle fingers, not the fingertips. Keep them flat and together. Why? Because using just 1 or 2 fingers can kind of poke and separate the tissue, making you think you feel a lump that isn't really there. This way, you get a nice, stable surface area. And here is the other crucial part of the technique, using different levels of pressure. In every single spot you check, you're going to cycle through 3 levels. Start with light pressure, just enough to feel the tissue right below the skin. Then, a medium pressure to feel a bit deeper. And finally, a firm pressure to feel the tissue that's closest to your chest and ribs. This is the only way to make sure you've examined every single layer. To make sure you don't miss a single spot, it is so important to use a systematic pattern. Think of it like mowing the lawn. You go back and forth in orderly rows to make sure you get every patch of grass. Same idea. So you've got a few patterns to choose from, and they all work great. The vertical pattern, that lawnmower method, is the one that's often recommended by doctors. You could also try the circular pattern, where you make small circles spiraling in towards the nipple, or the wedge pattern, where you imagine your breast as a pie and you check it one slice at a time. Honestly, the specific pattern isn't what's most important. The most important thing is to pick one, learn it, and use that same one every single month. And remember, your breast tissue covers way more ground than you might think. Your exam needs to cover the entire area from your collarbone down to the top of your abdomen and from your armpit all the way over to the middle of your chest. And I have to say it again, do not forget to check your armpit. Breast tissue extends right up in there. So what does a lump even feel like? Well, you're not searching for one specific thing. You're feeling for anything that feels different from all the tissue around it. It might be small and round like a pea, or hard like a little marble, or it could just be a thickened area that feels distinct from everything else. And that brings us to what might be the most critical part of this whole conversation. What do you do if you do find something that feels new or different? Okay, first things first, and I really mean this. Take a deep breath and do not panic. The goal here is awareness, not anxiety. Finding a change means the system worked. You were paying attention, you noticed something, and now you can take the next simple step. Panic is not part of that plan. And this is a fact you should hold on to. The overwhelming majority of breast lumps are benign. That means they are not cancer. They can be caused by all sorts of things, like cysts or just normal dense tissue. So, while every single change needs to be checked out by a doctor, finding one is absolutely not a reason to assume the worst. So here is your simple, clear action plan. First, schedule an appointment with your healthcare provider. Don't wait. Second, make a mental note or even jot it down of where the change is and what it feels like. And third, remind yourself that you've just done something incredibly positive for your health. By being aware and taking action, you are being your own best advocate. And really, that's the ultimate takeaway here. A breast self-exam is an amazing tool for self-awareness, but it's one piece of a bigger puzzle. It doesn't replace regular professional screenings like mammograms or clinical exams from your doctor. It works with them. By knowing you're normal, you become a better partner with your doctor, and you take charge of your own health. So keep checking in, keep being aware, and keep being an advocate for you.